At the KSMO studios, time for our spotlight on the Salem Memorial District Hospital. Deb Hobson with us today. Been a while since we've sat down.
Yes, it has. It's been a while.
How are you?
I'm pretty good. How about
I'm
yourself?
doing very well. Doing very well. Glad to have you aboard. Getting close to Christmas, and you know that this time of year between Thanksgiving and Christmas, everybody starts looking at staying healthy and trying to get to the families and friends and make the parties and create the
Yeah.
parties and then get a new year in, and then hopefully 2023 will be better. But right now we have a lot of stuff going on, not only just right here locally, but it's pretty much
It's
nationwide.
everywhere.
Yeah.
It's everywhere. Flu is definitely high on my list, and right now we're doing our flu vaccines at the hospital. We've been doing those since the end of September, so we have like a start date for flu vaccines and an end date. Our end date is the 15th, so anybody who hasn't had a flu vaccine at the hospital, employee, will have to have it by tomorrow. So a lot of people probably don't know that we the flu vaccine is one of those vaccines that's mandated every year for hospital employees to have to help keep us healthy. And I don't know if you know this or not, but I kind of looked this up. Like every month is like an awareness month for something.
Sure.
Like October being
Oh, yeah.
cancer.
Yeah, right.
Well, December, they have a week that they're awareness for flu vaccine, getting the vaccine, and community education's out there, and just how important it is to get your flu vaccine and do your best to stay healthy. And I know the strains sometimes are different from year to year, but
yeah. Always different.
always different. So you never know if it's going to be the right one. You hope that it is, but lots of people are pretty religious about getting that vaccine because it does make a difference for them. Some feel like they get a little bit sick after they get the vaccine. I don't know if that's just coincidental or what, but
But a lot of that is just, even if you get the flu, it would just lessen the severity of it.
correct.
And that's really the key, because you could get, we all know that these viruses mutate.
Yes.
So you can do whatever you want to in July to prepare for it, but come March, it's not going to be the same virus
Yeah.
that you're going to see. And that's really, in all honesty, Deb, the last few years, our peaks have been in the spring, late winter, early spring. They've been in February and March lately, haven't they? I mean, we really haven't
Yes.
seen a December spike in quite a while.
Right, that's true. I know that we're seeing a lot of positive flus right now, but and like you said, we're seeing a lot of those around January or February, and so some people are waiting till the last minute to get their vaccine just so that they feel like it's more effective. Typically, it's supposed to be effective from the end of September through March, but a lot of folks feel like it's not as effective, and so they're waiting till the last minute, and that's okay too, as long as we're getting it. And you're right, people that are immunocompromised, that have asthma or those respiratory conditions, no vaccine keeps you from getting the flu or COVID, but hopefully what it does do is keep you out of the hospital, keep you at home so you can take care of it at home and the symptoms are not as severe. And we hope that we don't get it, but we hope that if we do, that's the case. We're not
Right.
being hospitalized for it.
Right. But there are some people that are hospitalized for it, and you know as well as I do
True.
that can happen, whether you get a vaccine or not. It can attack
Sure.
you, and a lot of times what we're hearing now is people are actually getting RSV and
Flu.
or pneumonia and flu, or possibly even COVID and flu, or I think somebody even said the trifecta, COVID, RSV, and the flu all at the same time. I thought, you talk about a bad day.
Yeah, no kidding. So pneumonia, you're right. So if you're seeing the flu and you're having to be hospitalized, oftentimes the pneumonia is part of that. It's coming with that, and that makes it worse. And especially for those people that have those respiratory conditions, and the cold weather seems to trigger those kinds
Sure.
of things for them. So bottom line, the key is always good hand washing. I know that seems like a simple kind of thing that we just sometimes get complacent and we don't always wash our hands or we don't think about it, before we touch one thing to another thing, or I don't know, just for us at the hospital, before you go from one room to another, you're always washing your hands. You're foaming in, foaming out, as we call it, the hand sanitizer stuff. So for us, like before we do a procedure, be watching us. We're supposed to be washing our hands. do the procedure, wash our hands afterwards, go out of the room, hit the foam. We're supposed to be pretty religious about it, and if we're not, let us know about it, because it's our job.
We not only want to talk about washing hands, but just refrain from touching your eyes and your nose. I mean, if you get around
Correct.
there, and it happens. Okay, well, we kind of got a little bit complacent after COVID. Everybody did a great job washing their hands.
Sure.
Didn't see any flu. You didn't really see anything. People were really religious about wiping everything down. Well, Deb, they don't do that anymore. You go to a door, whether you're walking into a business office or whatever, you got to use your hands to open the door.
Correct.
All right, so you use your hands to open the door. Do you wash them or sanitize around when you come in? You used to, but you probably don't anymore.
Right.
And so people have gotten a little bit complacent doing that. And then also, too, like you mentioned, I remember one time I got very sick from the grocery store because I went home, unpacked the groceries, and didn't wash my hands after doing that. And I ended up, eating something. And the next thing I know, like 3 days later, I was sick. I knew right where I got it. I knew right where.
Mm-hmm.
Got it from the grocery store because I had... people take cans, they put it in their hand, they put it right back down.
Correct.
You don't know that.
And you don't know.
Yeah.
You don't know if they've washed their hands. You don't know if they're sick or have just sneezed or,
Right.
something. So, and home is the one place you think that you're for sure safe, and it's your own personal space. So, you know what goes on there, but we don't always think, I got to wash my hands every time. But kind of you do. We kind of still need to be wiping stuff down
Exactly.
and taking care of things.
And especially if you have kids. I mean, Bunker was closed down here last week because of the flu.
Mm-hmm.
If you have children that go to school, they're bringing it back. So even in your own
Oh,
domain, you need to be wiping down countertops, drawer handles,
Mm-hmm.
refrigerator handles. You just need to do it because, especially if they're going to school. Now, if you're maybe an older couple and nobody's leaving the house, you're good.
Yeah.
But if you
True.
have friends coming over, whatever they touch, you definitely need to go wipe back down because it is that time of year.
It is that time of the year, and families are getting together, and just be diligent and wiping things down and just taking care of each other, just looking out for each other. So that's one of the things that's pretty high on my list right now is the flu vaccines. We're seeing the increase in RSV and flu, and we've had some hospitalizations because of that. COVID's increasing a little bit. Numbers are still not real high for our area, but it's out there. So from what I understand, the CDC says we could be looking at a surge this winter with COVID. So we want to, again, good hand washing, be taking care of ourselves if we're sick and we have to be out. Even if it's just just you think it's allergies or sinus infections, go ahead and be putting that mask on. Are the masks 100% effective? Probably not. But if you're the one coughing and spreading the little droplets that go around,
Right.
the mask will help prevent that.
Right. Catch that.
Yeah. So just wanted to kind of touch base a little bit about some of the things that I'm doing in my office in the hospital. Is I do a lot of data collection as part of infection prevention.
Which you are, by the way, in charge of infection control.
I am.
That's
I
why
am.
we're here.
That's why we're here
And really,
today.
it came at a perfect time right now with everything going on, right?
Correct.
Yeah.
But one of the things I do is a lot of data collection, and then that's looking at every patient that comes into the hospital, if they're coming in with an infection and tracking that infection and determining whether the infection after they've been there for a few days, is it hospital-acquired infection or is it a community-acquired infection? And some people may not know this, but for it to be a hospital-acquired infection, it occurs 3 days after a hospital admission. Say when you came in, maybe we did a culture or something and that culture was negative, and you've been there 3 days and we had to reculture, well, that becomes a hospital-acquired infection. Now, that doesn't mean that it wasn't starting or incubating prior to your admission, but the key is the 3 days. So those are some of the things that I have to look at and record data and track and make sure we have them on the right antibiotics or that we're not giving him too much of an antibiotic. Sometimes we start out with those big guns because they're pretty sick. But we don't want to keep them on those big antibiotics for a long period of time if we don't have to. So those are some of the things that I have to do and look at and discuss with the physician and sometimes go down that road and say, hey, Do we want to keep them on that right now? You think we're at a point where we can take them off one of those at least? Because we want to get them off those big antibiotics if we can.
And there's a reason for that. Your
Absolutely.
body needs to fight off things. Your immune system needs to fight off things on its own for the most part.
Correct.
And it does. It does a great job.
Yeah.
There are certain things it has trouble with. Infections is usually one of those.
Yes.
And sometimes the viral infections become very dangerous, and that's why you want the antibiotics to start attacking those immediately. But if you just take antibiotics like candy over and over and over and over again, the efficiency of that antibiotic becomes less and less and less and less.
And that's true. So we build up a resistance is what happens. And then our body's not fighting it off, and the antibiotic's not working either. So, and viruses I know when we get sick and viruses make us sick and we feel really, really bad, but sometimes we shouldn't always treat those viruses with antibiotics because our body's ability to fight that off and take care of it like it should. And the more and more we do that, then the more and more resistant we become to antibiotics. So when we really need them, they're not as helpful.
Mm-hmm.
So we have to really be careful about that. So, but that's just one of the things I do. And of course, updating policies, and one of those policies that we had updated not so long ago has been the visitor restriction policy.
Mm-hmm.
So before, when there was COVID isolation patients or isolation patients, we restricted visitors from coming in. One, because the state tells us what we're going to do, and unfortunately, sometimes
don't have much choice in that one.
I don't have much choice, but that's relaxed a little bit. So and it's important that you get to have a visitor. I mean, if you're in the hospital for several days and you don't get to see anybody, and one, that's depressing. Two, it doesn't promote healing. So I'm really glad that we relaxed that, but we still have to be really careful about it. And those policies are in place for a reason. And so even our visitors are expected to follow those policies, and we are expected to make them aware what the policy is so that they can be informed as well.
One thing about that, and being that I was in the hospital during COVID, and I remember there was the no visitor policy, things of that nature, you start relying on the nurses to be your kind of sounding board. And, they're trying to do a job at the same time. And, of course, every time I had COVID, so every time they came in, they had to get in a hazmat suit and then come in. And then, they're there. You don't really want them to just walk right back out and take that suit off and throw it away. And, and then call them right back in. They had to do the whole thing again. Mm-hmm. So, you try and while they're in there, at least I did, because I'm thinking, they're busy, I'm calling them for a little, something's disconnected, it's beeping, and they're coming in, and that's all they need to do. I don't need any water, I don't need anything, I'm good, but I got to call them for this. So, try and round it out. Is there anything else you need? I'm trying to think, is there anything else I need, but you end up talking to the nurse for maybe 5-10, and they know this, 5-10 minutes, just because they're there, and you have nobody else to talk to. So you kind of start leaning on them to kind of be your pal and your sounding board and all this other stuff. But then if you have a need, that they're there too. So we really put a lot of pressure on the nurses, though, because they are treating, in this time you said 17 admissions.
Correct.
That's a lot of people
that is a lot of people.
Have if you had no visitors. And so when the visitors come, you can kind of relax, you take it easy. And you know as well as I do, it does promote good health. Being around family promotes you to get back and get healthy. Makes you feel better about where you are.
You need that interaction with family. You need to be able to stay updated on what's going on, and it's just helpful to get you home faster. So we have relaxed those visitation restrictions, and I'm glad that we have been able to do that. Some of the other stuff that we have going on, as well as infection prevention. I also do employee health and education. So I know we've talked a lot about education in the past, but mostly we talk about it on the ER side and the EMS side because it's advanced education. But you may not know that our nursing assistants or certified nursing assistants also are required to have some certification. Okay. And we require them to have 12 credits of education a year. And how we do some of that is through peak education. It's articles that we receive that they have to read and take a test. And then, of course, education that we do in the departments, like hand hygiene, which is a big deal. It's always a big deal. but stroke education, things like that, for those nurses assistants that work in long-term care. There's things that is very beneficial, and those articles pertain to a lot of those situations.
Sure.
So it's not just the emergency folks that we do a lot of education with, but it's also our nursing assistants as well. So the new thing that, I don't know how new it is really, but about a year ago, I guess, they even have to renew their certification. And that was something that we didn't have to do years and years ago. So it just more and more keeps being put on folks' plates, us and you all out there as well. But I just wanted to share that. We don't share as much sometimes with those folks as we do with the others. But
let's can you might want to clarify that. Is licensing through the state for nurses as well as, I mean, like for real estate
Correct.
people, you have a license through the state. Every 2 to 4 years, you got to take continuing education, provide that certificate, then they reissue you your license. Nurses, same?
nursing, we do continuing education with nursing because it's important to their field. They are licensed through the State Board of Nursing.
Okay.
Every 2 years, they have to renew their license, and of course, what the State Board of Nursing looks at is whether or not we've had any fines, our taxes paid. If our taxes are not paid, they're not renewing our license until all that stuff's taken care of.
Didn't worry about that years ago. They do now, don't they?
Oh, yeah. Yes, there's lots of things. They look at disciplinary actions, anything that could have happened. Are you actively working as a nurse? Things like that. Now, they're not requiring us as of yet to have continuing education credits just to renew your nursing license. Now, if you're in a specialty field, that's a little bit different.
Right.
But every 2 years, LPNs and RNs are required to renew their license, and those are the things that the State Board of Nursing looks at.
Well, so instead of continuing education, they want to make sure you're doing the job adequately so that
Correct.
they can license you again.
Correct.
Okay.
Correct.
Okay. So there are some contingencies as
Yes.
to when what your work conditions are and how you approach your work.
Yes.
Because if you kind of slack off a little bit and that gets noted, it can affect the possibility of your license renewal.
Absolutely. I think, and I think sometimes that you don't realize just how much can affect your license. So it's a big deal, and it's a lot of money and hard work you put into getting those licenses. So,
Exactly.
I would think you'd be paying attention and not, doing the best that you can do.
Right. Well, and like anything, I'm sure with the license renewal and things of that nature, there's always like if you would have, I don't want to say, I hate to say like denied, but if you were denied, you have an appeals process you can go to, and sometimes it's just somebody put it in the wrong file, or maybe there was a discrepancy as to, I didn't know they put that in my file. Nobody ever told me about that, and that didn't really happen that way. And so they give, obviously, the nurse the opportunity, or whoever's getting their license renewed, an opportunity to say, you got two sides to each story. You
Correct.
need to hear both.
Correct. And you're right. There is a process. They don't just not give you a license or just take away your license. I mean, they make, I feel like, every attempt to resolve an issue to the best of their ability. I mean, your license, if you do something really terrible, may be put on probation or
Sure.
something like that. Doesn't mean you don't get to work, because they could pull a license, for something really terrible. But there's a process and ways to keep your license and do what you need to do.
Now, we get a little off course, so I'm going to go
I
back to
know.
it. But, I mean, I want people to understand that there is responsibility for these
Yeah.
nurses, not only to treat the patient, but also to work with the doctors and have a good working relationship with their coworkers, because all that comes into play in how they're looked at and reviewed too. So,
Correct.
and
Correct.
the same with doctors. They all have licenses too.
Yeah, and sometimes, I don't know, I feel like sometimes we're all human. We all make mistakes. That's normal, but when you further your career or you get that license, we're kind of held to a higher standard, a higher expectation, and we need to think about that. I mean, I guess this is probably my own personal opinion. That's important. It's important to me how people see me, and I always want to put that best foot forward, and I think most people do.
You've been doing this a long time. Health field is a tough field.
It is
because You're not usually seeing people at their ultimate best
No.
every single day. A
You're
lot of
not.
times you're seeing them almost at their ultimate worst.
Mm-hmm.
And you have got people, and I know, I mean, if I'm not feeling well, I'm not going to be the nicest person probably in the world. And nurses and nurse practitioners and doctors, they do understand all this. And, you know, sometimes you may think, man, they're not listening to a thing I say. Well, you may not be saying what you really intend for them to listen to. You just may be angry.
That's true, and sometimes it comes across that way. But we're taught lots of different skills,
Sure.
and redirecting a conversation sometimes is helpful. Just to get to what the patient is really upset about, or
The root of the problem.
the root of the problem. And, you know, once we figure that out, then we can move forward.
Exactly.
And it takes some time. It takes some time on both, not just the patient's part, but the professional, the nurse's part, or the
Sure.
doctor's part. And I think we all try to do that. And we all have bad days. So I'm hoping, like, when the patient's having a bad day, it's not the nurse's bad day either, because that's a disaster
Yeah.
waiting to happen.
But it truly is an art to be a nurse.
There is.
It's an art to be a nurse practitioner. There's an art to being a doctor. You know, there really is. I mean, you listen and you know, you can, oh, everybody always complain, oh, the doctor didn't do this, didn't do this. Did you tell him about it? Well, sure. You know, you probably didn't tell him about it. How many times you go to the doctor, remember every single thing that you had wrong in the last 2 months, that I'm going to talk to the doctor about that? You forgot. I know. Me, I can say that every single time I go, there's something I was going to ask about. And as soon as I leave, I forgot.
You forgot,
I
yeah.
forgot about it.
I don't know about you, but I find myself making lists.
Yeah. But then I forget
So-
where I put the list.
So that's always a good thing, is to write things down
It
so you
is.
don't forget it. You know, especially those scheduled appointments. Sometimes when you're visiting the ER, it's for an immediate,
Sure.
you know,
sure.
so you don't think about that kind of thing.
No.
And that's not the most important at that time.
But when you do make an appointment to go
Yeah.
see your doctor, do try and write down every single thing that you find that's odd.
Mm-hmm.
It could be something maybe on your skin. You maybe found a new mole, maybe a blemish, maybe something won't go away. Doesn't seem to be healing very quickly. Don't just slough it off. And I think sometimes, oh, I've had that for a while. You shouldn't have that for a while if your body's healing correctly. If you've got a scab that continues to scab over, you may have a problem. You need to bring that up to the doctor instead of just saying, well, I've had that for years. Years? That's probably not a good thing.
Yeah.
But bring it up. I mean, there's a lot of times, too, if you don't feel right, if there's certain things that maybe, you know, I don't know, maybe your knee hurts at a certain time. Talk to the doctor about it. Maybe it's the beginning of arthritis. Maybe it's the weather that's doing that to you. Or maybe you've had an injury in that knee before, and all of a sudden the weather, now that you've gotten a little older,
True.
you know, like this change in weather, you'll feel it a little bit different.
Or true, and like that joint pain you're talking about, you know, what kind of medications are you on? Have you been taking them for a long time? There's medications out there that actually causes increased joint pain. Medicines that are good for us because we need them for other things, but that's part of the side effect of that medication. But so if you don't say anything, then we don't know to change it, and we don't know what we can do to improve it if you don't remember to say something about it.
And don't be afraid to question your doctor and say, okay, is that the best solution? Is there a way I don't have to take any drugs to get that same result?
Correct.
It may take you changing your diet. It may take you to need more exercise, or may even be go through physical therapy, because this exercise is going to hurt for a while, because it does happen. Sometimes you get an injury, you put it off. Well, you may have a calcium buildup in there. You're going to have to work that out, or we're going to have to do some different things. Or you're afraid to walk on an ankle, maybe if you've twisted and it hurts and it got
True.
swollen. It's not that you can't. You're afraid to, because you're afraid you don't have the faith in that ankle anymore.
True. And so, yeah, when things hurt, we don't want to use them. But like you mentioned, rehab, things like knee replacements or knee pain, and you're going to have pain with that, but rehab is the key to getting that better down the road and not having that pain. So sometimes we have to suffer through a little bit of pain to get better, unfortunately, but that's how it is.
And one of the things, Deb, you know about that, and we're really cannot get way over. But with rehab and stuff, listen to what they tell you to continue to do. It's not just go through rehab and then stop. because
No.
they're going to tell you you need to do this every day or
Right.
need to do this every other day, and whatever they instruct you to do it. Be religious about it. Make sure that if you have to go do 10 squats a day, and that's what they tell you to do, hold on to that chair and do 10 squats a day, then doggone it, every day do 10 squats. No matter how you feel, go do the 10
Yeah,
squats,
do it.
because that's going to keep that flexibility in the knee or whatever the situation, or maybe your elbows. Maybe you need to do stretches with your elbows. Might just be hold a bar in front of you and move it back and forth. Whatever the condition is, they're doing this for your better health. And when they're done with the rehab, you're okay. Well, you may be back if you don't do that, because now all of a sudden it's tightened back up. You've got calcium building up in there, and that's why the movement is so important, to keep those things flexible.
True. And when you stop doing something like that after you've improved, you're almost going back to square one.
Yeah.
And we're doing the process all over again. So,
But there's a lot of communication is really the key between
Absolutely.
the patient, the doctor, the nurse practitioner really is a key. But also communication between yourself and your family if you're hurting. Don't always hide something. If there's something that's odd, talk to your family member about it. Say, hey, I got this kind of lump on my back. I can't really see it. Can you take a look at it? Don't be afraid to do that.
right.
Because, and they'll say, well, let me take a picture. You got a phone? Take a picture. If nothing else, call your doctor and say, I took a picture of this on my back. Can I send it to you?
Yeah.
I mean, there's a lot of good stuff out there.
True. A lot of good stuff.
That can help the doctor, and they can say, yeah, let me take a look at that. Or, and if they look at it, let me come on in. I might need to look at this a little closer. We may need to take, a little scraping off it or something to see what it might be.
That's true.
Never
That's
know.
true.
But let's get back to where we were,
Okay.
because infection control is very important. The data is very important, because it does kind of, well, as you were already talking about, it helps with the policies of the hospital and about
And tracking.
and tracking what's going on.
Tracking the infection is really important. So one, if it is a hospital-acquired infection, then we need to figure out how come and why and what we need to do to improve and fix that so it doesn't happen again. So infection prevention surveillance is what it's called. So
Okay, that's a good name for
that's a
it.
good name for it.
Yeah.
Yeah, so that's an everyday thing that it doesn't go away and takes up a lot of time, but it's important time. Important that we
So
do it.
you had to scan records for this, obviously.
I don't
Or-
have to scan the records. I have to go digging for the information.
Okay, well,
So the record's already there.
Okay, well, I mean, you have to get the record, then you have to scan through the record to see
Yes.
what that cause might be, right?
Yes.
That's what I meant.
Absolutely.
Okay.
I do a lot of scanning too. So when you said that, no.
Oh no, okay. Well, yeah, that's probably not a good term for a hospital to scan. That's not a good one. But I meant, you actually have to take the file. You have to review it
Yes.
thoroughly.
Yes.
And try and isolate where this may have come from.
Correct. And then you have those discussions, you're talking with the lab department, the physician, the nursing staff. So it's a collection of people that get together that discuss, and we work on the problem. We try to fix it, make it better. I have one other thing that I'd like to talk about.
Sure.
The community blood drive is December 27th. We've got some flyers put out. You can go on site and make your appointment so you're not having to wait in line. Our goal is 15 donors this month.
Okay.
Our numbers have been a little bit low, and that's probably a little bit like the hospital has a community blood drive, and then one of the churches has one the next month. So that's part of the reason the drive has been a little bit low. But there's incentive out there. If you are a donor and you get to, if you will and can, and donate some blood, your name will be entered into a weekly drawing to win $1,000. And then, of course, the free T-shirt, as long as supplies last, you get a free T-shirt as well. So, and it's just it's a good thing. It's a life-saving measure, and if you're able to do it, we encourage that you do it. And hope to see you on December 27th from 9 to 2.
Now let's qualify that though. If you have been sick, or if you are
Correct.
sick,
They're not going to draw. You're not going to give any blood.
Right.
Yeah. So if you've been
you
on
need to-
antibiotics or
Right.
and you've been sick, correct.
Yeah.
You're not going to be able to do it. But
so please understand it. And if you think, well, I'm feeling great,
Mm-hmm.
But I just went off my antibiotics yesterday.
No, it's not going to happen. Yeah.
No, you
I
can't
think
do that.
I don't. I hope that I'm correct in saying this. Is I believe it's 7 days that you have to be off of antibiotics before you can give blood. Um, if you're unsure, they're definitely going to be able to tell you that when you come.
They're going to ask.
They'll ask.
Yeah.
Yes, they ask. So
Do they when you go online? You can go online and schedule this
you can.
at cbco.com. Is it .com or .org? Can't remember.
I can't remember either.
Community
and I
Blood
have
Center of the Ozarks is what you want to go to.
Yes.
And if you just type in Community Blood Center of the Ozarks, you will find it'll come up with one you need to go to. And
Correct.
it is, but I'm not remember, and I don't remember, haven't done this in a long time. If there's a part on there, like I know if there's something on there that says, "Have you been ill lately?" But I don't remember about the antibiotics being asked.
I don't know, but I
On
know
that
that they ask it every
pre-registration.
time you show up,
Yeah.
every visit that you come. So
You
I
think they might put that on a pre-registration?
and it probably
form,
is. And I meant to bring you some flyers so that I know that Jason sent it to you to put it out there.
I haven't got it.
You haven't got it, so I'll get some and bring them to you.
You need to get
I'll
that
hand
slacker
them.
going. Yeah, he's slacking off.
I'll get you some. I'll make sure
Yeah.
you get it.
No, I did
but-
hear about it, but
okay.
I don't have a flyer on
Okay.
it, no.
All right. So
But we'll be more than happy to promote that for you. You betcha.
perfect. Perfect. But if anyone has any questions or any concerns, they're more than welcome to contact me out at the hospital. My number is 573-729-6626. My extension is 6120. And if you, I thought maybe it'd be a good idea, maybe one radio spot we talk about diseases. I'm learning something new here recently, and you'd be surprised how many similar symptoms one thing has for another thing, and we don't realize that.
We really don't.
No.
You know, that's why sometimes when people go on WebMD and they go to their doctor and say, I have these 17 different diseases, and they all have these symptoms. Seriously? You have 17 of them?
Yeah.
But we all try and figure out what we have, and in doing
True.
so, then you type in these symptoms, and they come up with these different things. Well, there's underlying factors. That's why you need to have blood tests. That's why you need to go in there and see maybe there's something else that's there. Maybe a little your skin gets a little light or red or puffy or things of that nature that are also symptoms that are telltale signs that you have that particular type of
True.
disease
True.
or virus or whatever. So pretty medical field is an interesting field. It's not just something you can say. If you have a runny nose, you have a cold.
True. And I'm learning more and more every day on the infection prevention side, just what some of these infections look like underneath the microscope. I'm doing some training for
wow.
infection prevention folks, new infection prevention people, which is me. And so I am learning lots, and it's just very interesting. And the more I learn, the more I want to dig into. So you're right. It just is never ending.
Yeah. And somebody said, well, I have a runny nose. I have allergies. Oh, well, that just ruined that. You know, and everybody reacts differently, and everybody is different. And so, I remember some people I know, they take one kind of medication. One makes them sleepy, another one makes them anxious. It's the same medication.
True.
How does it do that? It's if it's making you sleepy, why does it make you hyper? Mm-hmm. But it can.
It can. True.
So you got to be very cautious about that. Deb, is always wonderful. You just ask people if they have questions to contact you. What is your phone number and extension, please?
573-729-6626, and my extension is 6120.
We always appreciate you coming in. You have a Merry Christmas,
You too.
and your family, and I understand you want to have it all in one day. That's a smart idea.
Yes.
And a very happy New Year if I don't see you before
Thank
that.
you.
We always appreciate all the information you pass on. And if you have any questions about that infection control, do ask, because it's easier to prevent than it is to get. And
Absolutely.
And if you can, do all you can to prevent it. And this time of year right now, we seem to have a lot of it out there. So wipe your house down, wash your hands, don't touch your eyes, nose, or mouth.
Wear a mask if you're coughing.
You know, and if you, if you're going to be out and about, do whatever you feel comfortable with people. Remember, also too, if you are going to cough, try and turn away use.
Right.
They always say kind of the crux your elbow, but a lot of people do touch people on their arm. You may kind of almost want to touch your shoulder with that. But if you can, turn away, try and get away from as many people as you can. Think about the
Absolutely.
other person. I know it's sometimes we all get kind of caught in a sneeze. It kind of comes out of nowhere, but I do try and think about the other person before expelling all that moisture and things, because once it's out there, can't
It's out
take
there.
it back.
You can't take it back.
No, ma'am. Thank you very much. We appreciate that, Deb Hobson from the Salem Memorial District Hospital. Our spotlight on infection control. Thank you.
Thank you.